Yeah, so again, welcome everyone. So as I said, I'm the board chair for the Indiana Balanced State Continuum of Care Board of Directors, and we are the governing body that oversees the continuum of care for the balance of state. And so as a general overview, the COC is, we're made up of 16 regions across the state of Indiana. We oversee 91 of the 92 counties that make up our state. We do not oversee Marion County, which will be a theme throughout this presentation today that you'll be reminded of several times as we work through the information that Daniela and team are going to share. So it really is a overview of the point in time count, which is a collaborative effort across the entire balance of state that includes many cities, counties, agencies, and people and volunteers. So I really want to make sure we take time to give a special shout out to those who are involved. You know, it's a cliche to say it takes an entire village to make something happen. In this case, that's not the case. It takes most of an entire state to make this count happen. So from our PIC coordinators, we had 20 this year who oversee the point in time count across the 91 counties. They do such a huge work to make this count happen. At one point, I was a point in time coordinator, and it is a really tough job. So kudos to those 20 people who volunteer their time to make that happen. Our volunteers, nearly 500 volunteers, made the point in time count possible, going out on super cold days in January to make sure we get an as accurate count as possible of people experiencing homelessness across our state. And this year we had over 100 agencies participate in the point in time count. So thank you to everyone who makes this work possible and does the hard work day in and day out to, for the people that we serve. And lastly, before I turn it back over to staff to start the actual presentation that most of you are here to see, we want to make sure to highlight the fact that while we're talking about numbers and data, the data presented today represents real Hoosiers experiencing homelessness across our state. And that's the reason why most of us are here on this call or doing the work day in and day out. So it's easy to kind of forget that as we talk about numbers and the amount of people that we're kind of counting. But they are real people who are sleeping outside in shelters, in their cars, or other situations. And so we want to keep that at the forefront as we go through the presentation. So with that, I'll turn it back over to Jesse and the team to jump right in, and we'll learn more about the state of homelessness in the balance of state continuum of care.
Thank you so much, Jordan. I'm very privileged to be here. My name is Daniela Jordan Gonzalez, and I am one of the three, I should say, HMIS data analysts here at IHCDA. And today I will be talking to you about the point in time count. But first, I would like to review the agenda with you. So this agenda is divided in 6 main sections, starting with me presenting the 2025 point in time count results and analysis, followed by the 2025 housing inventory count, or HIC, presented by Abigail Kornberger. Followed by Abigail will be Jesse Van Hooser, our COC engagement manager, and he will be talking about what coordinated entry is and how it is impacted by the HIC and PIT information, as well as how it impacts everything that the COC board does. Next, David Boltz, our other HMIS data analyst, will be sharing system level data and going beyond the day of the count, as well as contributing factors and how you all can get involved with the balance of state continuum of care. And at the very end, there is a slide for acronyms. So you will notice that we will be using lots of acronyms like HIC, PIT, CE, but all of those acronyms will be available to you at the end of the presentation. So the first thing to be reminded of is where the data is coming from. So David, Abigail, and I, as well as Jesse, we've worked on putting this information for you all together. And data is the foundation of everything that we're going to present to you today. And like Jordan mentioned, data, numbers, it's not numbers, it's people. So we're talking about people, and we want to share with you where those numbers are coming from. So there are three main sources. The first one is the HMIS, or Homeless Management Information System. The second is the DV Client Track, which is a closed system comparable to the HMIS, but for domestic violence survivors. And by closed system, we mean that the information that a client shares with an agency is only visible to that agency alone. So their information is strictly protected, and their privacy is protected as well. And finally, there are four HUD, or Housing Urban Development federal reports that are available, and that is the Housing Inventory Count, or HIC, the Point in Time Count, or PIT, the Longitudinal Systems Analysis, or LSA, and the System Performance Measures, or SPM. And we have pulled information from the archive of these four reports. So next, let's talk about some point-in-time basics. So some things that you need to know, whether you're here attending one of our State of Homelessness presentations for the first time, or you're coming back, this is a good information to give you some context about today's presentation. So the first thing is the recognizing that the point-in-time count is a snapshot, meaning that it tells the story of what happened on one day of the year. So it is an annual census. And the information collected through the point-in-time report is then presented to, as part of the federal report, AHAR, or Annual Homelessness Assessment Report, that is presented to Congress. So it is a very important part of telling the story of homelessness in our Indiana balance of state. This year, we decided to do the count on January 29th, 2025. So we did things a little bit different this year. We decided to do the count on the last Wednesday of January instead of the third Wednesday, which we used to do. And that is to allow more prep time for agencies, and especially those agencies or regions that rely on students. We thought it would be good to allow an extra week into the semester to make the collaboration more seamless. Another very important fact is that, like Jordan mentioned, the balance of state, the Indiana balance of state, encompasses 91 of the 92 counties, excepting Marion County. The information collected for the point-in-time count comes from paper surveys, as well as the Homeless Management Information System. This year, we had 50 more volunteers than last year, getting close to 500 volunteers, like Jordan mentioned. And we had 107 agencies participate in different capacities, collecting data, reaching out to people experiencing homelessness, and just being there for their communities. So we've talked about this in the past, about participating counties. We know that our balance of state is very large. It's a large territory to cover, 91 of 92 counties. But I want to share some exciting news. This year, 93% of the Indiana population was represented in the 71 counties that participated in the point-in-time count. And that is the largest number of participating counties and Indiana population represented that we've had, at least during the whole time that I've been here, which is going to come close to 6 years in October. So that is a big shout out to everyone that has participated in this year's count. 10 of these 71 counties were unsheltered only, meaning that they only counted people in unsheltered locations. And I'm going to go into what is the difference between unsheltered and sheltered in just a little bit. And one last thing here that I want to point out is that if you look at the map that says 2025 above it, there are 4 counties at the very north and then 3 on the southern part of Indiana. Those 4 counties that have kind of like a light blue, light teal color, those are the counties that did not participate last year, but did participate this year. The dark orange ones are the ones that were exempt last year and this year, and then you can follow the legend for the rest of the counties. So as I was mentioning before, defining what shelter versus unshelter means. So for the point in time count, HUD has very strict specifications as to who should and should not be counted as part of the point in time count. So there are 4 categories according to HUD that define homelessness. And for the purpose of the point in time count, only category 1, which means literally homeless, are the people that are counted. So that includes people in emergency shelters and in places not meant for human habitation, and also including those people in domestic violence shelters. So if you see on the table, people who are counted as part of the sheltered count are people who slept on 129.25 in emergency shelters, transitional housing, and safe haven for veterans. And people who were unsheltered were people who were sleeping in any place not meant for human habitation. And this could include cars, parks, abandoned buildings, and the other examples that are listed on that table. Now, people who are not included in the count are people who are couch surfers. They're in doubled up situations, hospital stays, incarceration, treatment facilities, temporary hotel stays paid by the person experiencing homelessness, and people who decline to participate in the count. Now, it is important to acknowledge that people who are unstably housed or who are at risk of homelessness, it's not that they do not matter. They do matter. But according to HUD, they do not meet that literally homeless definition. So that's why they are not counted for this purposes. And also something that I just want to reiterate is that people are missing if they do not choose to participate in the count, or if by some circumstance a PIT volunteer was not able to find that person. So it's important to keep this in mind, and I will share more about that in the next few slides. Something also to remember is that this year we had some changes, and I want to share these changes with you. They will help you understand the new information that we will be sharing in just a little bit. And it also provides some context as to why you might see some changes in some of the numbers that were shared in the past. So the first thing that I want to point out is the updates to the 2024 data standards. So this year, HUD released a notice saying that gender is no longer a required field. It was in the past, but is no longer. And sex is the new data point that will replace gender, and that will be collected starting on 10/1/25. So gender will still be present, but will no longer be required, and instead sex will be required starting on 10/1/25. Other changes that affected this year's count is that 2024 the 2024 count was undercounted because some services were not entered properly in HMIS. So when we share the 2024 total numbers in this presentation, they will vary from ones that were shared last year. And this is why, because we have made some corrections just to make sure that the information that we are sharing is most up to date. And lastly, the unsheltered chronically homeless population. So this was an issue that was spotted late last year or early this year, that there was a point in time report that was not showing the true number of people who were chronically homeless in unsheltered locations. So this issue has been fixed for 2025. So now we will present new information that hasn't been presented before regarding people in unsheltered locations who are chronically homeless. So this slide, in moving forward, we're going to talk about the PIT results, what they mean, and how they can be interpreted and how they can guide our actions moving forward. So first, there were at least 4,860 people experiencing homelessness on the night of the count. And out of those 4,860 people, 3,659 people were in sheltered locations and 1,201 people were in unsheltered locations. And just a little reminder here, these are at least 4,860 people, and amongst these 4,860 people, there are youth, there are families, there are single individuals, there are people with disabilities, there are single parents, there are older adults. So it is a variety of people who are experiencing homelessness. Like I mentioned before, it is important to mention that at least 4,860 people were experiencing homelessness. And that is just to reiterate the importance of not taking this number as a given, but this is the number that was able to be captured with all the effort and time put into this project, into this report. But there are many people out there that were not counted or chose not to participate that were also experiencing homelessness on the night of 1/29/2025. So what we can see here in this graph is an upward trend, meaning that more people are being counted. Um, at least if we go back to 2022 and even beyond, but there is an upward trend of people experiencing homelessness. And we see also that in that kind of like light blue color, there are more people that are unsheltered that are experiencing chronic homelessness. And we were wondering as a team, as we were looking at these numbers, if this is something that could be driving the increase in the total number of people experiencing homelessness. So before we get into what might be driving that increase in the number of people experiencing homelessness on the night of the count, I want to look at some population trends with you to kind of compare our population growth with other states as well as our PIT population growth with other states. So first, it's important to notice that the United States PIT results that were released for 2024, those results increased by 36% in the last year. So there was a 36% increase in the national PIT count published by HUD. And here in this chart, we see that our point in time results are very comparable with neighboring states, meaning the Indiana balance of state result increased by 17%. And you can see there Ohio or Michigan, they increased by somewhere around that percentage as well, with Kentucky having a little bit of a slighter higher percentage increase. And if we compare the Indiana balance of state PIT population versus the Indiana statewide population growth, we see that our PIT population has increased by 17% compared to 2.9% to the Indiana statewide population. So our growth in our homeless population is increasing at a higher rate than our Indiana statewide population. So that's something important to keep in mind. Finally, our homeless population is increasing. Oh, sorry, let me go back. Okay, so in this chart, what we can see is that the unsheltered population is increasing much faster than any sheltered population. So going back to what I was saying before, we wanted to know what was driving the increase in our numbers. And when we compare the percentage change between 2019 and 2025, our unsheltered population has increased by 123.6%. which is a big, big increase compared to 8.7% for our sheltered population. Jesse, you can go to the next slide. Thank you. So next, something that we're making available for the first time is a chronically unsheltered count. And what we see is that the chronically unsheltered count is rising from 88 in 2023 to 169 in 2025. The sheltered chronic homeless population is staying relatively constant, but we have more people who are chronically homeless between this time period. And this is information that is newly available. Something also that we wanted to share with everyone was comparing how the regions compare amongst chronic homeless populations. So for example, what we see here is that 1 in 3 people in Region 7 were experiencing homelessness and were chronically homeless. That equals to 69 people in Region 7. And for Region 2A, 1 in 5, almost 1 in 5 people, or almost 20%, were experiencing chronically homelessness. So this is important because what we want to say is that chronically homelessness is a real problem that needs to be addressed. And also, having this information is very, very important. So I just want to give a shout out to the HMAS team for finding the problem with the report and making changes so we can see these numbers. Answering the question that I previously asked in one of the slides, what is driving the increase in our total numbers? What we saw here is that people in emergency shelters, the number of people in emergency shelters has increased between 2019 and 2025 by 18.4%, whereas the people in transitional housing has decreased by 22.7%. So far we can say that some of the drivers of the increase in the point in time count have been people in our shelter locations and people who are in emergency shelters. Next, in the next few slides, I'm going to talk a little bit about demographics. So starting with gender demographics, this is a comparison between the breakdown of gender for our point in time count for this year in the BOS census. And you can see there that men are slightly overrepresented in our homeless population. Next, the age comparison. So I thought this was very interesting. You can see that people between 35 and 64 are generally overrepresented in our point in time count. And this is the age group 35 to 64 that represents the highest number of people in our point in time count. But also, like I said, they are overrepresented if you compare to the balance of state census data for Indiana. And here it's a different breakdown of age where I want to do a highlight on youth. And this is to show you that over 1 in 5 people experiencing homelessness is 25 years old or younger. So people under age 18 are the third highest population in our point in time count. Granted, it is a larger age range than the other ones, having 17 years for this one category. However, it's important to notice that people under age 18 and 18 to 24, they do present a little over 20% of our homeless population for the point in time count for this year. So We just wanted to highlight the importance of addressing youth homelessness, and giving a shout out to anyone and everyone who cares for the youth and does everything they can to prevent recurring homelessness and helping them at an early age to avoid chronic homelessness in the future. This is a breakdown of race and ethnicity. You can see the populations that were overrepresented compared to the BOS census data for Indiana. Um, and this is so to give you an idea of how overrepresented certain groups are, such as Black or African American and Hispanic or Latino. And lastly, for demographics, we have veteran status. Again, this is a breakdown between the PID count veteran status and the balance of state census veteran status for Indiana. It's very comparable. And last year we talked about how veteran homelessness is decreasing. And I think that is something that also needs to be celebrated, but also remember there are people who are veterans who are still experiencing homelessness. This next slide talks about barriers to housing. So as part of the point in time survey, there are some barriers to housing like mental health, substance use disorder, domestic violence, and HIV/AIDS that people can choose to report that that is a barrier to housing that they are facing. And something to keep in mind here is that this is not a pie chart or a donut chart because one person can choose one or more barriers. So that's why it wasn't ideal to use the round or circle charts that we were using in previous slides. But what I want to point out here is that at 26%, mental health continues to be the most reported barrier by people experiencing homelessness. This is not going away. There has been little to no change in the number of people reporting mental health issues. And it's important to keep this in mind for service providers, for legislators, anyone who wants to know maybe ways in which they can help the people experiencing homelessness. One more thing that can explain the increase or the driver or one of the drivers that is that can explain the increase in the point in time count is looking at different households. So for example, the households without children increased by 20%, whereas households with children decreased by 9% between 2023 and 2025. So there are more people in households without children being counted between these years than people in households with children. So just to do a quick recap, some of the things that could be driving the increase in our unsheltered population, or sorry, not our homeless population, is unsheltered people, people sleeping in unsheltered locations, people in households without children, and people in emergency shelters. However, even though people in households with children is slightly decreasing, it's also important to notice that even though households with children represent only 10% of the total number of households experiencing homelessness on the night of the count, the number of people in those households with children represent 25% of the total number of people counted. And that makes sense because there are many households in households without children that are single adult households. So that's why there's going to be fewer households in households without children and more people in those households with children than in households without children, where there might be just one adult or two. So that is important to keep in mind as well. Next, this is a new information that we analyzed this year is the point in time density. And this was to kind of put in context what counties see the higher point-in-time density per 100,000 people in that county. So Vanderburgh is the county with the highest point-in-time count density with 269 people per 100,000 people. And on the map there, you can see also other counties that had 150 people or more people experiencing homelessness per 100,000 inhabitants in that county. And lastly, this map shows you the unsheltered population by county, with Lake having the highest number of, or the largest number of people experiencing unsheltered homelessness at 167 people experiencing unsheltered homelessness on the night of the count. And with that, our analysis of the PID will lead you to Abigail talking about the housing inventory count. So Abigail, take it away.
Thank you, Daniela. We are now moving into the HIC portion of this presentation. Before we do so, though, we move into the housing inventory count results. I just want to take a moment to reiterate that all of the data we are presenting today does represent no Hoosiers experiencing homelessness. And additionally, the available beds that are in this portion of the presentation that I am discussing, they represent potential resources for some Hoosiers that are in crisis. So to discuss this year's HIC results, it is important that we establish some foundation around what the HIC is. The housing inventory count, it takes place on the same night as the PID. The housing inventory count produces the housing inventory chart, and this report is submitted to HUD with the PID simultaneously. This count aims to gather a snapshot of how many beds a project provides, how many beds are being utilized, and how many beds are available on this night across project types. The HIC is made up of projects that serve HUD's Category 1, literally homeless, and Category 4, attempting to or actively fleeing domestic violence definitions of homelessness. In this year's results, we will be looking at emergency shelter, ES, transitional housing, TH, safe haven, SH, rapid rehousing, RRH, permanent supportive housing, PSH, and other permanent housing, OPH project data. Now, for the purposes of this presentation, there are a couple unique project items to touch on before we start to look at their project data. On the HIC, you may notice that total rapid rehousing projects, RRH beds, match the number of people housed by the project in a 1-to-1. These projects do not have a set number of beds, but rather serve households of various sizes in their communities. The utilization rate for these projects will always be 100%. We will not be highlighting a utilization rate for this project type, but rather the total number of people that have moved into housing in a rapid rehousing project. TH projects, now while similar to ES, are projects that usually have a longer stay and other programming requirements. This will be important to keep in mind as we discuss bed availabilities. Lastly, for today's presentation, data from our ES and SH projects will be grouped together, and data from our OPH and PSH projects will be grouped together in all of the data sets for the remainder of this presentation. So here is a snapshot of the 2025 housing inventory chart results. We can see that there was a total of 9,826 total beds, 9,355 of these beds being available throughout the entire year. 166 organizations and 312 projects were included on the HIC this year. 238 or 76% of these were HMIS or DV comparable database participating. 74 projects being those that are not currently participating in either environment, but they were identified as serving individuals experiencing homelessness in our communities. The total shelter count for ES and TH projects was 3,673. We will look at this number with PSH projects included later in the presentation. We also saw an 83% year-round bed utilization rate among ES, TH, and PSH projects across the BOS. Now you may be asking, what is the difference between total and year-round bed count data? Total bed count includes seasonal and overflow beds counts for transitional housing and emergency shelter projects. Seasonal beds are only available usually during the coldest months of the year, and we see that being November through April. Overflow beds are only available if shelter locations are at full capacity. In this year's HIC, 471 beds were identified as a combination of seasonal and overflow beds. Now, this means the community may be able to meet their capacity need in January, but lack enough beds to do so in June. For today's analysis, we will be looking at year-round beds to more accurately reflect project capacity outside of these winter months. Looking now at a bed count breakdown across project types, emergency shelter beds make up the majority of year-round project beds at 4,240 beds. PSH beds are a second with a total of 3,161 year-round beds. ES projects also make up the majority of projects at 131 projects. Now, this tells us that the majority of our projects and beds across the BOS are serving people with immediate shelter needs, while 58% of projects are housing programs. Next, I want to highlight an increase we have seen in the last year in total number of projects. We have had 70 new projects with an operating start date in 2024, including those operating homeless prevention projects. 64 of these projects are new to the HMIS environment, and 8 of these projects are new to the DV client track, our DV comparable database. 55 of these new are ES, PSH, and/or transitional housing projects. It is important to highlight here that 45 of these 72 new projects are funded by the Temporary Assistance for Needy Families, or TANF program. This funding has provided additional resources for rapid rehousing and HP homeless prevention projects across the BOS for families who are at risk or experiencing homelessness. On 129, 989 people were identified as being housed by a rapid rehousing project. Of this count, 613 were households with children. Now, it's important to remember that this is a snapshot of rapid rehousing on 129.25, and households can be mixed in this count if their enrollment started after this date, they had not yet moved into housing by this date, or had moved into housing prior but were exited before 129. Therefore, it is key to remember that some Hoosiers are housed by rapid rehousing projects and are not reflected in this number. We will cover a more complete assessment of our age later in this presentation. Next, let's shine a light on the regions and the work each and every community is doing for our most vulnerable Hoosiers. There are 2 sheltered counts represented here. One shelter count is including and excluding PSH beds. Of the 16 counties that make up the BOS, 7 regions served over 400 people in ES, TH, and PSH projects on the night of the pit. Those are highlighted here in blue. Regions 12, 3, 2A served 731, 872, and 908 people respectively. This represents a tremendous effort from each organization across the 16 regions. 3,673 people may have been experiencing unsheltered homelessness if these ES and TH beds were not available. Now we want to look at the project level. 8 projects served over 100 people on the night of the PED. And these projects are located in regions 2A, 2, 3, and 13. The majority of our projects, at 67%, are smaller in capacity. 209 projects served under 30 people on 129.25. And across the BOS, on the night of the PID, each project served on average 26 people. Now we're going to look at a map, and this is broken down at the county level. So this is a map of year-round ES beds in one bubble, and in another bubble, ES and TH beds by county. The ES beds are represented in the blue bubbles, and the sum of TH and ES beds are represented in the orange bubbles. Allen County is the county with the most transitional housing beds at 371 beds. Elkhart, Madison, Monroe, and Delaware counties, in that order, have the second, third, fourth, and fifth highest counts. Glancing now at another county map, we are looking at total PSH bed counts. We see that Allen, Lake, Monroe, and Vandenberg have the greatest number of total PSH beds. Now, talking about bed utilization is an important topic, but it is key to understand that there may be many reasons why someone might not enter a shelter, project, or program. Some of these reasons are shown on the screen. The program may serve a specific population and might require a household to split between different projects or agencies. A geographical barrier, a lack of transportation may impact an individual's decision. Sometimes someone remains in an unsheltered location due to the difficulty in finding a program or bed that allows their pet to reside with them. Certain programs or shelters may have high barrier enrollment requirements. Or it could simply be a matter of personal choice, or that shelter, project, or program is just not the right fit for the person. Now, with that being said, looking at utilization rate, on the night of the pit, we saw a total utilization rate of 83% across ES, TH, and PSH projects. This breaks down to a utilization rate of 91% for PSH projects, 72% for ES projects, and 58% for TH projects across the BOS. Looking now at the region level, of the 16 total regions, 8 have an average bed utilization rate higher than the average utilization rate, that 83% across the BOS. These regions are highlighted here in blue. The lowest utilization rate that we saw was 61%, and that was with significant changes in regional and agency leadership in that area. The BOS, on average, continues to trend towards better utilization rates. Here we will take a first look at the number of available ES and TH beds by region in comparison to their unsheltered count. These are beds that were not occupied on the night of the pit. On average, there were 46 available ES and/or TH beds per region across the BOS. As a reminder, there are many reasons why someone may not utilize a shelter, project, or program. This map is another representation of the data we touched on first in the last slide. On the left, you will see available ES beds in orange, available TH beds in light blue, and the overlapping number of ES and TH beds in a county in green. On the left, you can see the unsheltered count per county. We see that counties with a smaller amount of ES and/or TH beds available often have a higher count of unsheltered individuals. I will now pass the presentation over to Jesse to cover coordinated entry.
Thanks, Abigail. Very briefly, we want to touch on what coordinated entry is. Coordinated entry is the path by which people experiencing those Category 1 or Category 4 homeless situations can be connected to housing programs. As a reminder, Category 1, literal homelessness, and Category 4 represents individuals fleeing, attempting to flee, or deciding to flee domestic violence. Coordinated entry is a streamlined and organized approach that works to unify the way individuals experiencing homelessness enter into housing programs. The coordinated entry system for the Balanced State Continuum of Care covers the entire 91 of 92 counties in Indiana represented by the Continuum of Care. It is required by HUD that all agencies with Emergency Solutions Grant or Continuum of Care funding that are housing programs use coordinated entry for referrals. It is also household focused. It puts the needs of the individuals and families at the center of the process. The purpose of CE is to remove side doors to allow equal access for clients across the COC. A standardized assessment of a client's vulnerability is completed and used to place the most vulnerable on the prioritization list for housing. Speaking of that assessment process, in 2024, the Indiana Balance of State Continuum of Care began utilizing its newly developed Collaborative Housing Assessment Tool, or CHAT, to gauge vulnerability and eligibility through coordinated entry. The new assessment was designed to be a phased and progressive process, to be strength-based and empowering. It was intentionally worded, and it is data reliant. By designing its own process, the Indiana Balance of State Continuum of Care will be able to evaluate, monitor, and adjust the assessment process to meet the specific needs of Hoosiers experiencing homelessness. Lastly, to briefly touch on some CE data before I pass it off to David, in a 1-year period from July 31st, 2024 to July 31st, 2025, over 8,500 CE assessments were completed. An important aspect of CE as a balance of state is the unified process across multiple regions that allows for this to be a consistent way to enter into the system. Individuals must be reassessed every 90 days while experiencing Category 1 or Category 4 homelessness, and must be reassessed if returning to homelessness. This means an individual may be included in this number multiple times as multiple assessments during the 1-year period based on their individual circumstances. Additionally, as of yesterday, there were just over 2,550 households on CE prioritization lists across the balance of state. Of those, roughly 1,150 scored a 12 or higher, which indicates high vulnerability for the household. On the right, you can see a breakdown of those CE list sizes based on the region. And lastly, there is a link to find your regional CE lead for any particular region there. Next, I'm going to turn it over to David to talk about some system level data and a little bit further from there. David.
Thank you, Jesse. As Jesse mentioned, I will be covering the system level data as well as some statistics beyond the night of the pit. First, I'd like to explain a little bit about the LSA and SPM. The LSA refers to the longitudinal system analysis, while the SPM refers to system performance measures. As a reminder, these are 2 of the 4 required federal reports that we give to HUD. Both the LSA and SPM provide continuums of care with a look at their overall system performance. The LSA provides a granular look at how individuals interact with the system, while the SPM provides high-level data about total people served. This includes data about the average length of time homeless, as well as information on successful project exits. Now let's take a look at some of the data from our most recent LSA. This data is from the period of 10/1/23 through 9/30/24. The report shows that 12,753 people were served in 9,602 households across the BOS. On average, these individuals were in homeless situations for 99 days, and this is an improvement from previous year's LSAs. Of those exiting to permanent destinations, only 8% return to homelessness. Next, I'd like to share some of the positive outcomes that we see from the LSA for this reporting period. We see that 1,373 total households were served in RRH projects. This is from the report of 10/1/23 to 9/30/24. On average, those individuals were housed in RRH projects for 221 days. Of households exiting these programs, 79% exited to permanent destinations. Information from this slide comes from the system performance measures. This is a reporting period of 10/1/23 to 9/30/24. In total, 2,249 people were housed in permanent housing projects, and 2,088 people remained in PH projects or were exited to permanent housing destinations. A highlight that we see from this report is that nearly 93% of clients either stayed in PH or exited to permanent destinations. Next, let's go over the exits to permanent destinations. Of the projects types shown above, 86% of clients that exited permanent destinations did not return to homelessness. Earlier, Daniela and Abigail shared some of the barriers that our unhoused populations face when seeking stability. As I share the next few slides, keep in mind that unforeseen circumstances can easily put us all in a similar situation. The information on this slide comes from the Indiana Housing Dashboard. From this information, we see that the number of available housing continues to decline. In the last few years, the percent of Indiana homes that are vacant and available for occupancy is now lower than the national average. Of those vacant homes, only 18.4% are available for rent. With the recent decrease in available housing for rent, here is a resource that shows the number of hours required at minimum wage to afford common housing types. For reference, to afford a 2-bedroom apartment, a household must earn $22.18 per hour in order to avoid paying more than 30% of their income on housing. To learn more about this study, feel free to review the full Out of Reach report from Prosperity, Indiana. The link to that report is on the bottom of this slide. Now, the information from this slide comes directly from an ALICE report conducted by Area United Ways. ALICE stands for Asset Limited, Income Constrained, but Employed. In this example, we see a minimum survival budget with common expenses compared to different household types. The federal poverty level shown here is for a family of 4. This is still set at $30,000. The household with 2 full-time workers is based on the most common job types for Indiana and their median wages. With the median household, we do see a budget surplus, but keep in mind that this is compared to a survival budget. This does not include common expenses such as student loan payments or minimum contributions to credit cards. Additional resources, including a complete breakdown of the survival budget, can be found through the link on this slide. The first chart shown here not only shows those below the federal poverty level, but also the many families in our state that are living paycheck to paycheck. The second chart provides another way to visualize the different household types mentioned on the previous slide. Links to these resources and reports will be available in a follow-up email provided after this webinar. So how can I get involved with the Indiana Balance of State Continuum of Care? There are a few different ways. First, you can volunteer with your local PIT count agency. You can direct people to your local regional planning council, as well as participate in the meetings yourself. You can share this information with your community, or you can talk to local providers and discuss their agency needs. Also, be an active participant in your local community's dialogues. Your local RPC or Regional Planning Council publishes information that you can share or help them with data analysis. A link to a list of regional contacts can be found on this slide. And the information here will be sent out in a follow-up email as well as posted to our website. As Daniela mentioned, we use several acronyms in today's presentation. So as promised, here is a list of those acronyms and what they stand for. Feel free to use this as a reference going forward. Thank you so much for taking time out of your day to participate in today's webinar. We will be posting information from this webinar shortly to the HMIS Data Portal website. Thank you again for joining us, and we hope you have a wonderful rest of your day.